So let's talk about how vitamin D can actually reduce your inflammation. But the first thing we need to understand is what actually is inflammation? Well, it's this: the immune system response to a stimulus that is viewed as foreign or toxic to your body. We call that an antigen. So an antigen is something that is foreign to the body. It's a threat to the body where your immune system then has to attack it and get rid of it and dismantle it or neutralize it. In the process of dealing with this foreign threat, we're going to create inflammation. And inflammation is going to mobilize our defenses, okay, the white blood cells. So inflammation is part of the defense mechanism, very similar to the TV series The Game of Thrones, where they had to defend the wall. Well, in your body, you have an army of cells that are constantly defending against foreign attacks. So there are some incredibly sophisticated strategies and complexities within your immune system. You have cells like the B lymphocytes that act as advanced guards to protect certain tissues. Neutrophils are like kamikaze pilots that will drop certain chemical bombs to kill invading microbes. Then you have macrophages, which basically gobble up the invaders. They just eat them. There's no bombs involved. They just will consume them. And then the T lymphocytes track down and destroy the invaders. And they use certain chemicals. They might use hydrogen peroxide and other oxidizing agents. Now, a fever is used as another mechanism to literally cook these microbes to kill them. But with inflammation, we get a blood rush to the area that can bring the immune weaponry. Now, with an inflammatory condition after an injury, that's slightly different. Your body's not trying to kill anything off. It's trying to mobilize a joint, for example, to prevent motion. Your body will produce pain signals to tell you, don't move, let this area heal. There's all sorts of reparative actions coming in there with collagen and scar tissue to help mobilize and basically repair the tissues. So with inflammation, you either have an overreaction or an underreaction, depending on what's going on. So one of the biggest weapons that your immune system has are inflammatory chemicals like cytokines, prostaglandins, and leukotrienes. So these chemicals are communication messengers that help signal and trigger the white blood cell army. So it can tell the immune system what type of cells should be triggered and how many should be triggered. And this is a very important part because if it miscalculates or misestimates and it has too much immune system, you can create too much collateral damage. And that's exactly what happens in autoimmune diseases. You have your own immune system that's attacking itself and destroying the entire body. And then you have this other effect, vascular dilation. So you get swelling, you get redness, you get more blood flow in the area. So inflammation has a purpose, but the problem is if there's too much firing or not enough firing and the collateral damage. Let's get to vitamin D. Why is vitamin D so important? Vitamin D is an immune modulator. Okay, what is a modulator? That is something that modifies or controls something. It varies the strength of something, okay? So vitamin D either turns up or turns down these chemicals right here. Just like aspirin will inhibit and turn down prostaglandins, vitamin D will do the same thing, but guess what? It has no side effects. So whether you have inflammation from an injury or an immune reaction that has become chronic or an autoimmune condition, vitamin D is one of the best approaches to take. Now, as far as how much to take, I would take minimally 20,000 IUs. If you're in the chronic phase, you might want to go up to 30,000 IUs, 40,000, maybe even 50,000 IUs. You have to make sure you have vitamin K2 with it as well. Now, if you just take a look at how many people in the US alone have arthritis, asthma, allergies, autoimmune diseases, fibromyalgia, and these people are not taking vitamin D because if they were, they wouldn't even have the symptom, and they're usually deficient in vitamin D. It's just completely unnecessary for them to suffer with pain and inflammation because vitamin D is so powerful. So if you have inflammation or you have pain or you know someone that has inflammation that's gone on too long, recommend vitamin D, at least 20,000 IUs. It would be good to have them take it with food or with a little bit of fat because it's a fat-soluble vitamin, which will help them absorb vitamin D a lot better. And the last thing I'm going to say, and then I'll stop talking, is that the majority of the population is deficient in vitamin D. We don't get outside, we don't get it from the sun as much anymore, and it's almost impossible to get vitamin D from your food. Thanks for watching. So if you want more knowledge on how to create a healthy body, subscribe now and get daily notifications.